Hi, I'm Dr. Joanna Buscemi, and I'm here today to talk to you again about cognitive behavioral therapy, or CBT. But today our focus is going to be about the thoughts piece of the triangle. And so as I've mentioned before, our thoughts can be really powerful and they can affect our behaviors and our actions and also our emotions. And there are strategies that you can use or tools that you can use within CBT to help you to adjust your thoughts to make them a little bit more helpful and more accurate. Unfortunately, a lot of us can automatically have some very negative thoughts that can be pretty dangerous for us overall. So, for example, we talked about this thought: after breast cancer treatment, I'm never going to be the same. I'm never going to be back to normal, for example. And we talked about how this type of thinking can lead to isolation or inactivity, and this can lead to some sadness or maybe feelings of depression. And so what I'd like to discuss today is called thought stopping and cognitive restructuring. I realize this is kind of a fancy term, but I'll explain it so that we can understand a little bit more about what it means. So essentially what this strategy is about is, can you identify your negative thoughts? So sometimes our thoughts come so automatically that it's hard for us to catch them and to stop them, especially when they're being harmful to us. And so step one is being able to identify your thoughts. What are they and which ones are negative and harmful? And once you can identify those, the second step is really to replace this with a more helpful thought. So we talked about over here with the never the same, never normal. One way to restructure that thought, or to tell yourself something different that's more accurate and more helpful, is to say, I've just been through a really difficult life event, very difficult treatment, and things have changed, but I'm adjusting now to real life, to life outside of treatment. And it's going to take some time, so I should be patient with myself. And when you tell yourself a thought that's like that, that's very accurate, but also a little bit more helpful, you might feel a little less depressed, maybe even a little bit motivated to go out and be active and live your life. Another negative thought that we hear a lot from survivors of breast cancer is that the cancer will come back. I just know it, the cancer is going to come back. I know that's a main concern for you all, is recurrence of breast cancer, and that's completely understandable. But this thought can really increase people's anxiety and negative thoughts about their life in general. And so if you're able to catch this thought and identify it, the next step is, how do I replace this? So what are some other things you could tell yourself that might be really accurate but also a little bit more helpful? Well, when I'm looking at this, I would say one way you could restructure this thought would be to say, I'm going to my regular appointments to my doctor, I'm doing the best I can with my follow-up care, and I'm doing all the things I can to prevent recurrence from happening. And so that way it's a little bit more realistic, a little less negative, and again, maybe even a little bit motivating to help you to stay on track with your appointments and to follow up with your doctor regularly. So the overall idea here is, can you identify your negative thoughts? Can you tell yourself something a little bit differently that's more helpful? It might even be motivating for you as you're transitioning after breast cancer treatment. And how is that then affecting your behaviors and also your feelings and your overall well-being? So here's another strategy that you can try on your own to see if you can improve your mood.